Located along the busy Toro Highway, Bugiri Hospital is one of the signature 24 hospitals built more than 3 decades by the government of Dr. Apollo Milton Obote and strategically located to cater for the health care needs of a large part of Busoga sub-region. Surprisingly, when we reached into this hospital, the image does not reflect a referral hospital. The needs range from medicine, reliable doctors and nurses, and sufficient beds for those admitted in the hospital. Patients we talked to revealed that the situation they face in the hospital needs urgent intervention by the relevant authorities. The area RDC Chikomeko Margaret Manomuiza, after making a surprise inspection, found anomalies within this hospital.
That's when I asked him where he had got the blood from for the 20,000 that he had been given, and he told me he had got it from Dr. Isaviri's clinic, which is a private clinic. So immediately I called Isaviri, who told me he's in Kampala, and I must definitely be able to follow him up. He said blood was free and it wasn't supposed to be paid for. And since he declared that it was free, definitely it means he must refund the 20,000 that man brought, so that we give it back to that man.
According to the patients, the hospital lacking blood is not new because it has been the order of the day, which needs serious intervention by the relevant authorities.
Mama radisi akubadano kujja kuno omusayi aleta ate kubana abana abasatu
era omusayi gwaida
era gukali bagira kuno na
omusayi gusoboyire okuida aye okuva ku sawa week 12 okuva ku sawa week 12 bale batolere sente paka sawa eno omusayi tugwide sawa eno omusayi gwakakola ki okuida.
The RDC ordered for the blood at the nearby clinic. However, unfortunately, we got information that one of the children who was in the need of blood passed on.
So now, at this time, when the kids were so much in acute care, I felt saving lives at that time was more important than putting this character in prison immediately. So I instructed him with Dr. Isaviri to give the blood to these acute care cases, and they immediately did it, and the blood is on, and the kids are now being what? They are on blood. There was also sentiment that still the health workers are not working very well, that they don't want to respond. For example, for the drugs, they say that the drugs were brought, because for the last week, actually it's true, there haven't been drugs, even nationwide. But they bring drugs twice. They bring every after 2 months, they deliver drugs from the National Drug Authority.
John Francis Okecho, the Executive Director for Friends of Christ Revival Ministries Uganda, spoke of what he described as a situation beyond the visual eye.
This is a symptom. There must be a very big problem, and we are committing ourselves as Bugiri as one to come back here. We are going to have a bigger meeting to see how we can involve every stakeholder in this district to sort out this problem of people being charged money for a service which is supposed to be free. And that's why some of us, we are coming in to fight for the people of Bugiri, to see that such kind of discrimination, such kind of charges are eliminated from our people. So we are going to work with the leadership. We are going to sensitize our people to see that the services that are supposed to be going to our people, they benefit without discrimination.
Meanwhile, Kadama Edisa from Mochilongole A reveals that her child of 6 years, who no longer performs his usual task, was in nursery. Unfortunately, from nowhere experienced the disease. They did not know its background. Headed to Mulago, but she was not helped. The report is filed by Kaggwa for WBS News.